Hello and welcome. My name is Kent Gross. We're going to be talking today about legal and ethical issues in nursing informatics and about how HIPAA compliance and security breaches affect that. This is for the YSU Department of Nursing, class Nursing Informatics, NURS 3725, and Professor Calcagni, October 12th, 2025. So first of all, what is nursing informatics? It's a specialty in nursing, along with basically all specialties in nursing, including technology and science, into their nursing practice, according to the ANA 2015. It affects every nursing specialty. According to McGongle and Mastrain 2022, some examples of like nursing informatics would be an EHR, which is an electronic health record where patients' data is secured. Also, nursing informatics examples would be communication tools within healthcare programs, electronic orders in the EHR, and telehealth nursing, which is a whole specialty. Some legal issues within nursing informatics and about HIPAA would be how legally nurses have to follow the federal and state laws that are given to them, along with specific hospital policies regarding nursing care and best practice. A very important law example would be HIPAA, which HIPAA stands for Health Insurance Portability and Accountability Act. According to the U.S. Department of Health and Human Services, HIPAA helps protect patients' privacy and health information, inpatient, outpatient, in hospitals and not. Some ethical issues here. Ethically, nurses need to verify informed consent for patients. Nurses do a lot with ethically within patient care. Also, accessing patient information that is necessary, and only that is necessary, not more, not less. That's according to the ANA 2015. Also, the ANA Code of Ethics that we must use as nurses and within the healthcare field consists of autonomy, benevolence, non-maleficence, justice, fidelity, and veracity. So some of those are big words. We'll go through definitions here. So autonomy is basically the patient's right to make their own decisions with their healthcare, saying no to things, saying yes to things. Sometimes that is going against what the provider may think is best for them. Basically, they have the right to choose because it's their body. Beneficence is doing good for the patient. So as a nurse, as healthcare workers, doing what is right for patients, and always doing that. Non-maleficence is not doing harm. So kind of like doing good, but just basically not doing anything to harm the patients. Justice is fair treatment for all patients. We're not treating someone better or worse based off of if they're rich or poor or healthy or not healthy. We are not discriminating against people. Fidelity, keeping promises with patients and basically keeping trust with them, showing that you are trustworthy and worthy of providing them care. Veracity is being honest and transparent. If you're not being honest and transparent with them, you're not going to have their trust either. And that's a patient right there, according to the ANA ethics. HIPAA. So we're going a little bit more about HIPAA. We gave a definition, talked about what HIPAA actually stands for. So let's talk about some strategies to protect patient information within HIPAA. So some strategies according to the U.S. Department of Health and Human Services are A, not talking about patient information other than with like approved healthcare workers or family. So if you're giving out patient information to family that the patient does not allow it to go to, then that is breaking HIPAA policy. or if you're sharing it with like your coworkers who are not taking care of the patient, then that's also breaking HIPAA. Making sure that passwords are encrypted. You're not like reusing the same passwords, especially with electronic health record. That goes along with a lot of hospital policy. There's always usually a second or third party you have to go through to log in. Also, not leaving a patient chart open where other people can see them or access them is pretty important, especially in the hospital. You know, you're going into a bunch of different rooms, and you really got to make sure that you're not keeping it open. You got to log out every time. So what data is protected under HIPAA is pretty important too. According to the U.S. Health Department and Human Services, the patient's name, their date of birth, their address, medical record number, healthcare information, and other patient information. We're not to share that. And we're also not able to share anything that would like identify a patient specifically, or at all. So basically it's best to just not to talk about work outside of work, those specifics. So some consequences of security breaches. According to healthit.gov, some consequences of security breaches are breaking HIPAA policy, which we just talked about. So some repercussions of that would be possible legal actions. You could have your license revoked, lawsuits on the hospital or yourself, and you could even have jail time with that. And then losing patient trust. Obviously, if you're sharing their information or what's happening to people that they don't want to know, they're not going to trust you anymore. They're not going to want you to give them care. And it could also hurt them if they like had their identity stolen. So that could harm the patient. We want to prevent that at all costs. So in conclusion, according to Hebda et al. In 2019, while implementing new technology strategies in the nursing and healthcare field, it's important for patient care to have new technology. It helps efficiency, and they get the best care possible. But it could open up the patients to data leak for their information. So we want to make sure that we're protecting them at all costs. So all healthcare workers, nurses, techs, doctors, we want to protect our patients and protect ourselves from possible legal issues or sharing data. So I've also got some references here. Let me flip the camera around here. Beautiful. Have a good one.